As you are aware, cancer remains a global public health concern, with close to 10 million deaths recorded in the year of 2020. In Kenya, it is the second leading non-communicable disease after cardiovascular diseases, with 42,000 new cases and 27,000 deaths recorded every year as per WHO. The leading cancers we observe are breast, cervical, prostate, esophageal, and colorectal cancers, most of which can be prevented through screening and early diagnosis. It is, however, unfortunate that majority of the patients seek medical attention in late stages when it is difficult and expensive to treat. We are gathered here today to change this narrative. Today we are launching the National Cervical Cancer Awareness Month to familiarize ourselves with risk reduction measures as we take action to prevent this disease. Ladies and gentlemen, I wish to inform you that we now have all the tools that we need to eliminate this disease, and indeed, cervical cancer is the first cancer that has been marked for elimination. We know what causes this disease. The HPV infection causes up to 99% of all cervical cancer cases. It takes 10 to 15 years for the changes in the cervix caused by HPV to develop into cancer, giving us an opportunity to screen and treat to prevent cancer. We have a vaccine targeting the HPV infection, which is safe and effective to prevent this disease now and in future. We also have effective treatments available both for the pre-cancer lesions as well for cancer itself. In fact, I'm happy to note that indeed Embu is one of the counties where we have established a regional cancer treatment center that will continue to support with the essential chemotherapy medicines. Therefore, I bring a message of hope that indeed cervical cancer can be prevented and eliminated. My ministry has led the development of various policies and guidelines to guide the implementation of various strategies to ensure that we as a country are not left behind in the elimination of cervical cancer. The National Cancer Screening Guidelines have been disseminated to all counties, are freely accessible online. The HPV vaccine is available free of charge in all facilities providing routine immunizations for children across the country. We are working towards vaccination of 90% of girls from the ages of 10 to 14 years, screening of 70% women between 35 and 49 years of age, and providing treatment and care for 90% of women identified with these cervical cancer diseases. I therefore call upon all of us to act now to stop cervical cancer. And I listened to Governor expressing in her mother tongue how you people should come out and get treatment, which, Governor, that's a very good thing, and I believe they have understood it. I will not say it in English. On our part, we remain committed to achieving the Sustainable Development Goal by reducing premature mortalities from cervical cancer, and that Kenya's future generations are free from cancer. Apart from these trainings that we have received here today and other training materials that have been provided, we have an e-learning platform, the Virtual Academy. We are planning to conduct more skill-based trainings from next month. In collaboration with the Clinton Health Access Initiative, we have distributed over 800 thermoablation and 200 LEEP devices for treatment of pre-cervical cancerous lesions to health facilities. We have also, for the first time, introduced HPV DNA testing in 27 county referral hospitals, which is the recommended gold standard method for cervical screening. Ladies and gentlemen, we will continue to empower community health workers on cancer using the training materials that we have developed so that they can educate their communities and mobilize them for screening and HPV vaccination. Na nimefurahi sana wale health community workers ambao wametutumbuiza na wakatufunza mengi kuhusu kansa. Asanteni sana. Let me take this opportunity to congratulate and commend Embu County, the land of opportunities, for prioritizing health as a top agenda. Indeed, our greatest wealth as a nation is in our health. The government, under the leadership of His Excellency the President, Dr. William Samoei Ruto, remains focused on delivering quality universal health coverage for all, especially anchoring on primary health care to ensure access and equity, and we therefore recognize and support your efforts, Madam Governor, and look forward to working with you to improve healthcare in your county. I appeal to all private healthcare providers to join us in this cause and to consider removing barriers such as high costs for cervical cancer screening so that more women to take up the services. The Ministry of Health will continue working with counties and all partners to eliminate cervical cancer in Kenya. As we seek to transform NHIF to a social insurance, we will look into the packages so that screening, diagnosis, and treatment for cervical cancer is well covered for all Kenyans. Finally, ladies and gentlemen, na watu wa Embu, nataka niwaombe kwa moyo mnyenyekevu tuweze kujiandikisha na NHIF. Tumeanza reforms kule kwa ministry yangu na hivi karibuni tutakuwa tunawaeleze malipo mapya, kwa sababu ni vyema ya kwamba hicho kiwango kisongeshwe chini. Na Rais alitangaza akasema ya kwamba akichaguliwa hiyo hela ambayo inalipwa 500 itapunguzwa. Your Excellency Governor, we are doing our mathematics, and so far it looks like we shall begin at a figure of about 160 going upwards. For those of us who can pay more, like me and you, Governor, we'll pay what we need to pay. Kwa sababu mimi na yeye tunaweza lipa hata 20,000, si ndio? Na mama mboga alipe ile kiwango anaweza, ama namna gani? Asanteni sana. Your Excellency, I have seen the work that you have been able to do so far, but I want to assure your people that Embu level 5, in the next few months, it is going to be transformed. So as we live here today, together with my teams at the National, we are going to work on something, together with your CEC and your Chief Officer, to ensure that we deliver a good facility for your people.